Your dog can't tell you when something is wrong, but their body is constantly giving signals. Some of these signs may seem harmless at first, but they could actually be warning signs of a serious health condition. Ignoring them could put your dog's life at risk. Today, we'll uncover 15 crucial signs that your dog might be critically sick, and why immediate action could make the difference between life and death. Please subscribe and give us a like, and make sure to watch until the end, because the final sign is one that most dog owners overlook, yet it can be one of the deadliest. Sudden loss of appetite. Dogs love their meals, and if your pup suddenly refuses to eat, it's a major red flag. A single missed meal may not be a concern, but if your dog consistently turns away from food for more than 24 hours, something is wrong. Causes can range from minor stomach upsets to serious illnesses like kidney disease, liver problems, or even cancer. Keep an eye on your dog's behavior. Are they acting sluggish? Are they drinking less water? If loss of appetite is combined with weight loss or vomiting, it's time to call the vet immediately. Difficulty breathing. Breathing problems in dogs can be terrifying. If your dog is wheezing, gasping for air, or showing signs of labored breathing, don't ignore it. This could be a sign of heart disease, lung infection, or even heat stroke. Pay attention to how often your dog breathes heavily. Panting is normal after exercise, but if it happens while resting, something could be seriously wrong. If your dog collapses, has blue gums, or struggles to breathe, rush them to the vet immediately. Their life could depend on it. Excessive vomiting or diarrhea. A little stomach upset isn't unusual for dogs, especially if they've eaten something unusual. But frequent vomiting or diarrhea can be a serious warning sign. If your dog vomits multiple times in a day, has diarrhea that lasts more than 24 hours, or you notice blood in their vomit or stool, this could indicate poisoning, a gastrointestinal blockage, or even a deadly virus like parvovirus. Dogs can become dehydrated very quickly, leading to life-threatening complications. Don't wait, get them checked by a vet immediately. Sudden weight loss. If your dog starts losing weight rapidly without a change in diet, take it seriously. Sudden weight loss can be a sign of diabetes, kidney disease, parasites, or even cancer. You might notice their ribs becoming more visible, or they may seem weaker than usual. While gradual weight loss can be normal for aging dogs, drastic weight drops in a short period should never be ignored. A vet visit is the best way to determine the cause and start treatment before it's too late. Extreme fatigue or weakness. Dogs sleep a lot, but if your normally active pup suddenly becomes uninterested in playtime or struggles to get up, pay attention. Extreme lethargy can be caused by anemia, infections, heart disease, or internal bleeding. Does your dog seem weak or unsteady when walking? Are they refusing to go outside? If this lasts for more than a day, don't assume they're just tired. Get them checked by a vet before their condition worsens. Persistent coughing. A little cough isn't always a problem. But if your dog has been coughing for weeks, it could signal something serious. Persistent coughing can be a sign of heart disease, lung infections, or a collapsing trachea. Pay attention to the type of cough. Does it sound dry and hacking, or wet and phlegmy? If your dog is also wheezing or struggling to breathe, it's a clear sign that something is wrong. Don't delay, seek veterinary care immediately. Bloated or swollen stomach. A swollen stomach in dogs is never a good sign. If your dog's belly suddenly appears hard or distended, and they seem restless, pacing, or drooling excessively, it could be a sign of gastric torsion, also known as bloat. This condition is life-threatening and can cause a dog's stomach to twist, cutting off blood supply. Large dog breeds are especially at risk. If you notice these symptoms, do not wait, get to the vet immediately. Difficulty urinating. Have you noticed your dog straining to urinate, only producing small drops or showing signs of pain? This could be a sign of a urinary tract infection, kidney stones, or even a bladder obstruction. In male dogs, it can also be a symptom of an enlarged prostate. If your dog is whining, licking their private area excessively, or showing signs of discomfort, don't wait. A urinary blockage can be fatal if not treated immediately. Watch for any blood in the urine or sudden accidents in the house. These are all warning signs that your dog needs a vet visit right away. Seizures or tremors. Seizures can be one of the most frightening things for a dog owner to witness. If your dog suddenly collapses, starts shaking uncontrollably, or loses consciousness, it could be due to epilepsy, poisoning, low blood sugar, or even a brain tumor. Some seizures last only a few seconds, while others can go on for minutes. Either way, they should never be ignored. If your dog experiences a seizure, stay calm. Move them away from any dangerous objects, don't try to hold them down, and time how long it lasts. If the seizure lasts more than a few minutes or happens multiple times in one day, take your dog to the vet immediately. Unusual bad breath. Bad breath in dogs isn't just a minor inconvenience, it can be a sign of something serious. A sudden, foul odor coming from your dog's mouth could indicate kidney disease, diabetes, or even a severe infection in their gums. A fruity or sweet-smelling breath might suggest diabetes, while a smell like rotting meat could mean a serious dental infection. Left untreated, oral infections can spread to the bloodstream, leading to life-threatening conditions. If your dog's breath smells worse than usual and they're also drooling excessively or having trouble eating, it's time for a vet checkup. Pale or blue gums. Your dog's gums can tell you a lot about their health. Normally, they should be a healthy pink color. But if your dog's gums appear pale, white, or even blue, this is a major emergency. Pale gums can indicate anemia, internal bleeding, or shock, while blue gums mean your dog isn't getting enough oxygen, possibly due to heart or lung failure. If they stay pale or blue, get to a vet immediately. This is a life-threatening condition that needs urgent care. Excessive drinking and urination. Have you noticed your dog drinking way more water than usual and urinating frequently? This could be a sign of diabetes, kidney disease, or even Cushing's disease. While drinking water is normal, excessive thirst, especially if your dog is waking up at night to drinks, should not be ignored. Are they having accidents in the house? Are they losing weight despite eating normally? If these signs appear together, schedule a vet visit as soon as possible to rule out any underlying health issues. Lumps or unexplained swelling. Finding a lump on your dog can be alarming, but not all lumps are dangerous. Some are harmless fatty tumors, while others can be cancerous growths. The key is to monitor any new lumps for changes. If it's growing rapidly, feels hard, or is causing your dog pain, don't wait. Some lumps may also appear suddenly due to infections or cysts, but it's always best to have a vet examine them. Dragging back legs or stumbling. If your dog suddenly starts dragging their back legs, stumbling, or showing signs of weakness in their hind limbs, this could be a sign of a serious neurological issue, spinal injury, or arthritis. Some breeds, like Dachshunds and German Shepherds, are prone to conditions like intervertebral disc disease, IVDD, which can lead to paralysis if untreated. Immediate veterinary care can make all the difference, especially if early treatment can prevent permanent damage. Sudden behavioral changes. Dogs communicate through their behavior, and sudden changes could signal a serious health issue. If your once friendly dog suddenly becomes aggressive, withdrawn, or fearful, it might not be just a mood swing, it could be pain, neurological issues, or even a hidden illness. Watch for signs like excessive hiding, sudden snapping, or a loss of interest in favorite activities. Sometimes, conditions like brain tumors, infections, or cognitive decline in older dogs can lead to personality shifts. If your dog starts acting off without an obvious reason, don't ignore it. Have them checked by a vet to rule out underlying medical issues. If you've noticed any of these signs in your dog, don't ignore them. Early detection can save lives. Always trust your instincts. If something feels off, consult a vet immediately. Have you ever experienced a health scare with your dog? Share your story in the comments below. And if you found this video helpful, give it a like, subscribe for more pet care tips, and hit the bell icon so you never miss an update.